Hello, everyone, and welcome back. This week, we're going to take a look at the older horse and its care. And I'm Ellen Rankins. I'm a graduate student with the Equine Science Center at Rutgers University. And here with me today, I have Dr. Karen Malinowski, who is the director of the Equine Science Center. So, Dr. M, would you be willing to share a fun fact about yourself to get started today so our listeners can learn a little bit more about you?
Well, I think all of our listeners, Ellen, know that I'm crazy about horses. I mean, that's just a given. I mean, to have been in this business for over 40 years and still be here and loving it, I'm crazy about horses, and their well-being and their care and their management. And so all of the research that we've done over the last 40 years really is focused on horses. But what people might not know about me is, so I love horses. I'm totally addicted to harness racing, and there's nothing better than sitting behind a wonderful trotter or pacer and going 35 miles an hour, and it's just a thrill of a lifetime. So yeah, I'm addicted to harness racing, but I also have a huge passion for Dalmatians. And so some of our listeners may not know that. And so, just in your honor today, Ellen, and for our listeners, my racing colors also are Dalmatian print. And so I'm wearing this for you guys today to see that not only am I crazy about horses, but I'm also crazy about Dalmatians.
Thanks for sharing that with us. We very much appreciate it. And so to kick off our discussion today on the older horse, the first question we need to address is just how old is old for a horse and how we determine that in the horse.
Okay, good question, Ellen. We've been studying the aging process in horses for almost 30 years at Rutgers. So beginning with Dr. Sarah Ralston's nutrition work, and all of the work that we've done with exercise and cardiovascular function and immune response with Dr. Horhoff from the University of Kentucky, um, we have a good body of data. Um, the interest in the care and management of the older horse has increased around the world. And so the Havemeyer Foundation has held 3 summits to talk about and present work about the aging process in horses at sponsored by Tufts University. And so we've met 3 times now. And at the last meeting, which was several years ago, we all collectively, probably about 25 of us at these meetings now, um, agreed that from all of the data we're seeing from everyone's lab, the horse starts to show physiological changes with age when it reaches 20 years of age. So for those of us who have a young horse or a teenage horse, a late teenaged horse, we have not seen differences between young horses and middle-aged horses. So that's good news for those of us who are competing and using these equine athletes into their late teens. We start to see changes when the horse reaches 20. So, you know, but in hindsight of looking at our mascot for Equine Science for Kids, our beloved Lord Nelson was with us until 42, and I was still riding him when he was 39. So to me, that's old. But Ellen, to answer your questions from a scientific standpoint, horses start to show signs of aging when they reach 20.
Okay, thank you, Dr. M. And so our next question is, so we all know hopefully a little bit about aging in humans as we've watched our parents or grandparents get older. And so how would you compare the process of aging in horses and humans? Are they at all similar?
They're very similar, Ellen. And so the horse really is the best animal model that we have for human medicine because they age like humans. You know, they have a long life. They're not a 6-month lab rat. I mean, they can live till 20 and 30 years of age. Um, they certainly love to exercise. They're the only animal model we have that sweats like humans. And so, um, and looking at immune function, insulin sensitivity. So a lot of the infirmities that we see in humans, like arthritis, like diabetes, like a reduction in cardiovascular function, anaerobic capacity, a reduction in immune function. The older person and the older horse both are immunocompromised. So there is a lot of similarities between horses and humans when we
Okay,
talk
good
about
to know.
the aging process. Yes. So, as I've gotten older, I've enjoyed doing this research with the older horse because I see a benefit two ways. One is we're certainly improving the quality of life of the older horse, but we're learning a lot about the science that we can apply to some human medicine as well.
Okay, so you've talked about some of these changes that occur with age, and some of them are related to health. So what are the most important things someone could do to maintain their horse's health as that horse ages and kind of reaches that age of 20 or beyond, and why are those things important?
Um, I think we certainly, first and foremost, from a health standpoint, you have to look at nutrition of the older horse. We aren't studying a lot of that anymore, but I still think a lot of Dr. Ralston's earlier work. The older horse needs, there is a reduction in nutrient retention, there is a reduction in digestibility. So things like an increased protein, increased fiber, possibly a supplement of vitamin C, and a little bit more phosphorus in that older horse's diet. And you also have to look at the type of food. What does the dentition of the older horse look like? Lord Nelson at 42 still had every tooth in his mouth. And so he had no problem eating beautiful hay. So I think horse owners, need to look at um, what's the horse's body weight like? Is it having trouble chewing and that sort of thing? Green grass, a 12% concentrate, possibly a supplement of oil if the horse is losing weight. Those are all things that need to be looked at. Um, so nutrition and overall health is important. Your veterinarian should check this older horse a couple of times a year. The dentist, equine dentist, should check the horse's teeth a couple of times a year, etc. We also want to talk about, regarding health, Ellen, are vaccinations and overall health and well-being. So we have done work in collaboration with David Horhoff, who was originally at LSU and now is the head of the veterinary science department at the University of Kentucky's Gluck Equine Research Center. We've collaborated on many studies with David. And some of our earlier work definitely showed that there is an immunosenescence, a reduction. The older horse becomes immunocompromised, both from a cell-mediated standpoint, where the cells that fight infection pathogens. And we also have data that shows there's a reduction in antibody production, or the humoral side of the immune response, in response to a vaccine challenge. And so we have to be concerned. I mean, you should be concerned that your horse is always vaccinated um, against disease based on the recommendation of your local veterinarian. But I think as the horse gets older, because they are immunocompromised, we don't know how long they are protected. So it might be worth a discussion to say our horses need to be these older horses need to be vaccinated 2 times a year or every 6 months, and not just once a year. And so here in New Jersey, we have a season of, April, May, and people like to give their spring vaccinations. We still, in September into October, have a very active mosquito population. And a lot of these diseases, like Triple E, Western equine encephalitis, as well as West Nile virus, we still have an active mosquito population, and the older horse may need to be revaccinated to offer protection against those diseases. Um, Another area that we need to look at is the aerobic capacity and the importance of exercise. And folks, we have done many, many, many studies. I think the most important thing we can do to help our horse maintain its mental and physical well-being is to have the horse exercise as much as possible. All horses love it to have a purpose. Even the older horse loves to have a purpose. To have an older horse just be in a stall um, is not the best thing that we can do for it. For older horses love to exercise, and while like humans, there's a change in cardiovascular function where plasma volume decreases as the horse gets older. These are in a group of horses 20 plus. Um, so therefore, the stroke volume decreases and cardiac output is a formula of stroke volume, the amount of blood the heart can pump with one given stroke or beat, times the heart rate. And so Cindy Betros did some wonderful work here at Rutgers that demonstrated that stroke volume, plasma volume does decrease in the older horse. And so the older horse, to exercise and to also thermoregulate, the heart needs to pump harder. It needs to have more beats per minute than the younger or the middle-aged horse. And so to keep up with the ability to exercise, blood flow going to the muscle so that the muscles have energy to exercise. We also know that the older horse does not thermoregulate as easily as the middle-aged or young horse. And so horse owners need to be very, very careful in exercising the old horse on hot, humid days, just like we tell our senior citizens. Don't go out in the noonday sun and do a 10-mile jog when it's 95 degrees and 100% humidity. That's just not smart. So keep your older horses in the shade, keep them cool, ride them in the early morning or in the evening once the sun does start to go down. But you may need to skip a couple of exercise days when it really gets, the heat index gets to be really, really, really high. And the
Yes,
last,
and that's very relevant given today where we are right now in the summertime too. So definitely something to keep in mind.
right. And so, we also know regarding going back a second to nutrition and heat, the old horse loses weight and needs a little more food in the wintertime just to keep its body heat. But older horses also lose weight in the summertime. So it is very important to watch and monitor your horse's weight. Both heat as well as cold do impact the ability of the horse to keep those calories, keep themselves in a good body weight and condition. The last point that I want to bring up, Ellen, and it kind of ties into a whole bunch of these things, um, and again stresses the importance of exercise. So we know in people, and we also know in some brilliant work done by Dr. Amanda Adams beginning in Dr. Horohoff's lab years ago. They both coined a phrase called inflammaging. And this definition is really an increase in inflammation in the body that occurs with age. And so Amanda has a great body of science that has shown that with older age, there is an increase in a bunch of inflammatory cytokines in the body, such as TNF alpha, interferon gamma, IL-6, IL-10, IL-2. And so the horse, as older humans also, are in this inflamed state. And we now know that one of the primary causes of diabetes in humans, and we don't call it diabetes in horses, we call it insulin resistance, or there is a decrease in insulin sensitivity after a glucose meal or after a carbohydrate meal. Insulin rises and plasma glucose stays up and doesn't respond as easily to um, that rise in insulin or that increase in plasma insulin. So this increase in inflammatory cytokines has been suggested to be one of the primary causes of this reduction in insulin sensitivity. So in Amanda's wonderful work, she thought, well, and she has a herd of about 40 old horses at the University of Kentucky now. Some are insulin resistant. Some have, equine metabolic syndrome. Some are thin. Some are obese, but they're all old. And so Dr. Adams demonstrated that you do see this increase in inflammatory cytokines with old age. Then she thought, is it just age? Or could it be actually the body condition or the state of that animal? And so she took an equal group of old horses that were thin, or a body condition score of, let's say, under 5 on a scale of 1 to 10. And the other group of horses were old, but they were obese, a body condition score 8, 9. And she looked at the same inflammatory cytokines, and what she saw was it wasn't just age, that the old, thin horses had a significantly lower production of inflammatory cytokines when compared to the old, obese horses. And so another reason for keeping your horse fit, keeping it exercise, because you can't just do it on diet alone, just as people can't. Exercise is a critical component of all of this. And so exercise certainly is important. And another thing that Dr. Adams did was she then put these horses, both the thin group and the older group, on a calorie restricted regimen. Inflammatory cytokines definitely came back down in those obese horses. And then when she returned the obese horses back on a higher caloric intake on a daily basis, the inflammatory cytokines rose again. So exercise is important, and diet is keeping the old horse not obese is critical, because then you can start to see an improvement in insulin sensitivity with changes in diet and exercise.
You've made this really strong case for the importance of exercise for the older horse. But we know that sometimes you can overdo exercise, are saying that there can be too much of a good thing. So how do you go about determining what is the appropriate level of work or exercise for a horse, especially as they start to age?
I think, Ellen, a good horse person will know the answer to this. It's certainly monitoring and listening to the horse, and let the horse tell you how it feels. So for instance, I can share with you, and when we know that older horses become arthritic, are they sore? I mean, do they have joint issues? Do they have musculoskeletal issues? That they will tell you that they cannot do this. We know that aerobically, they cannot perform to the level that they did when they were teenagers or younger horses. I mean, you can't take a 20-year-old horse and necessarily race it around the track. But the standard protocol that we have used in our research projects studying age has been 3 to 4 times a week of exercise at 60% heart rate max, just like what human exercise physiologists recommend. To improve your cardiovascular system, to improve your aerobic capacity, 3 to 4 days a week of at least 30 minutes at 60% heart rate max can condition you and your horse. And that we have seen repeatedly. That is true. One study that we did with 3 age groups of horses, and we did exercise them on the equicizer 4 days a week for 30 minutes. And we had the horses grouped, if those of you who have been to our exercise phys lab know that we have paddocks surrounding the red barn, and the horses are out. We try to keep our horses out as much as we can, and they are out in groups in these paddocks. Well, when we would come in the morning, these horses and the old group of horses, Ellen, the mean age was 27 years. I had a trotter on there who was 30 years old, and she would race trot on that treadmill, on the high-speed treadmill at 30 miles an hour and never break into a canter. She loved what she was doing. So we, as the experiment, so this was 12 weeks of exercise conditioning. As the experiment went on, 3 to 4 days a week, the horses, when we got to campus, to the barn at 7 o'clock in the morning to begin our day's work, they were all standing, lined up at the gate, waiting, not for food. They were waiting to go on the exerciser. And as the groups of horses were exercising, the mares were standing in the paddocks watching their counterparts exercise. And then when they were done and we turned them back out, they all would run around bucking and kicking, and oh my gosh, they were just having a blast. Knock on wood, we had some of the younger horses who were lazy and didn't want to exercise compared to a horse like Chablis, who at 30 was just brilliant in her day-to-day work as well as her high-speed treadmill work. So I think, using common sense, again, in consultation with your veterinarian, does an older horse possibly need a little bit of an anti-inflammatory agent like phenylbutazolidine every once in a while to keep it not sore in some of its arthritic joints? But again, LNU never saw Lord Nelson, but at 40, and if you looked at his conformation and the arthritis on his knees and his ankles and his hocks, and when he moved, you could hear every bone crack in his body, he would still gallop and run around. So, I think it's a mental thing with people and horses as well, that some of them push through a little ache and pain. But again, I am a staunch supporter of exercising older horses and keeping them outside and keeping them walking around. My Could Be Magic is 29 years old now. He's getting up there. He has horrible hindquarters from his racing career. His hocks are awful, but keeping him walking. He has a paddock mate, another former racehorse, who constantly, he's the aggressor. He pushes Magic around and forces him to walk all day long. And I think it's keeping him much sounder than if he had been, sedentary.
Right. Okay, well, we're going to train tax a little bit now that we've covered some of this stuff. So we know in people that senses like hearing and sight often decline with age or change with age. Do you know of any research on senses in the horses as they age?
Ellen, I do not. And this is a great question. I do know, that Chablis, one of that good trotter, she went back to her home because in watching her on a daily basis, knew that she was starting to lose her eyesight. She didn't know where she was, and I could see that she would follow her pasture mates around, like using them as a guide animal because she, trusted them and she knew that she could follow them. But I know that if you waved your hand in front of her eyes, she didn't flinch. She couldn't see. So I didn't want her to pass on here in New Brunswick. So we did take her back to her home in Rhode Island, and that's where she spent the rest of her life. But whether they lose a sense of taste or a sense of smell, um, I think some of the older horses get a little demented, just like we do. But there's no scientific documentation to prove that.
Okay, well, definitely some areas for future research then for all our aspiring scientists out there. Is there anything that I've missed today that you really wanted to share with our audience on the topic of the older horse?
I don't think so, Ellen. I mean, again, we know a lot of work. We've done a lot of the work here at Rutgers, and we still collaborate with Dr. Horohoff and Dr. Amanda Adams at the University of Kentucky. Again, I think the take-home message is horses do have a reduction in aerobic capacity as they get older. They do not thermoregulate as easily as they did as they get older. However, our work showing that after intense exercise, that the older horse's core body temperature is elevated quicker compared to the younger horse, and the heart rate at that core body temperature is significantly higher than the younger horse, they recover very quickly. And so by 10 minutes after the end of that exercise, the old horse and the young horse, there was no difference in their heart rates 10 minutes after that intensive exercise. So again, be smart, don't be stupid. Don't exercise your horse outside on a hot, humid day in the sun, but the older horse can still exercise. And we saw after 12 weeks of exercise training, the old horse can increase its aerobic capacity significantly compared to before it started exercise training. So you can continue to condition your older horse with regular exercise. It can still improve its aerobic performance. It can improve its insulin sensitivity with exercise by reducing those inflammatory cytokines. And I think another thing, because the older horse we know, is immunocompromised, we need to make sure that they are vaccinated properly. And it might mean 2 rounds a year instead of just one series of injections. But again, to consult with your veterinarian on a plan for your older horse.
Absolutely. Well, thank you very much for sharing your time and expertise with us today, Dr. M. Always a pleasure to have you.
My pleasure, Ellen. Thank you.